Hey guys, Dr. Brandon Schreiner here. I'm joined by my partner in crime, Dr. Mary. Thank you guys so much for tuning in. I can't believe it. We're week 4 of our Fearless Immunity Masterclass series, and my favorite topic of all time, we're talking about the nervous system, right? So I know we beat this into you as patients. Why do we get adjusted? We're talking about the science and some neurology behind why chiropractic isn't just good for neck and back, but really for your overall health and well-being. And so, today, a little bit about me, and then I'm going to let Dr. Mary take over and share her story. I mean, you guys kind of know my story. Chiropractic literally saved my life. I did not become a chiropractor because I thought it was a good idea. I became a chiropractor because I had a career-ending neck surgery. It actually bolted my spine together at C5, C6. After that, I had debilitating migraine headaches. I had all kinds of health issues, and a chiropractor set me down and explained the principle of health and healing, about how the body works, how the brain communicates to the rest of the body. And I tell this all the time, like at 36 years old, I'm healthier now than what I was at 21. I haven't taken a medication in 15 years. And just this principle has infiltrated my home. My kids have never really been to a doctor besides myself. They've never ever taken a medication. They were, all these things because of the principle of chiropractic has literally changed my life. So I'm super excited that I get a chance to share this. And then we have Dr. Mary here.
Hello. So my story is I've been a chiropractor going on 25 years next year, and I haven't always been a max living doctor. I actually worked in a symptom care office. So I just thought, patients came in when they were hurting, I worked on them, and then when they felt better, they were done with care. And so I really didn't know what true health actually was. So once I got into max living, it just completely changed my life and my family's lives, because I actually figured out what health actually was.
Yeah.
I thought I was healthy. I exercised a little. I thought I ate well, but by no means did I eat well at all.
How much weight have you lost?
So I've lost 60 pounds
60
in the last 4 years since I got into max living.
That's right.
So it's been great. I exercise even though I hate it. I know it's good for you. I do that, and my husband's healthy. He used to get allergies every spring, every fall, really bad. And he gets a little bit. Right now he's got a little bit, but he's not off work. He's not taking anything for it because he doesn't have to anymore.
That's cool.
My daughter Corinne, she's 17. She doesn't really get sick either. She hasn't missed a day in school in 2 years now. So it's been great,
Cool.
just because of anything. So she just keeps going, and Max Living just changed our lives, and it can change yours too.
That's cool. So a few things that we're going to talk about, and kind of the purpose of today's or this week's immunity series, and when it comes to chiropractic is really, what is chiropractic? And what is chiropractic's role in keeping you well? I think a lot of times people think of chiropractic as neck pain, back pain, or I get in a car accident and I go to a chiropractor and I get my neck and back popped, but it's really the tip of the iceberg. I mean, it's not even really what chiropractic was founded on. Why is chiropractic vital for everybody, regardless if you have symptoms? And I think sometimes people think that, well, I don't have any symptoms, I don't need to come see you. That's totally not true. Chiropractic is about making sure the body is healthy and healing all the time, regardless of symptoms. What is the difference between corrective care chiropractic and more of a symptom-based, chiropractic model? Kind of like what Dr. Mary was talking about, where she came from. Not that was bad. I mean, there's a time and a place for that. But why do we see newborn babies? Why do we see people that, come to see us on a weekly basis and they have no problems? The key is they just don't want to get problems, right? So number 5, why the 5 essentials play a key role in spine health. So a lot of chiropractors, you go in, there's Tootsie Rolls and cheese sticks on the front desk, and it's why do we teach the 5 essentials? Not because we think it's a good idea. It's actually vital for the nervous system to eat healthy food, exercise, and take good quality supplements. So I'm going to let Dr. Mary explain what the nervous system is and its role, because she does this every single day.
So, of course, the nervous system, it controls the whole entire body. It gets your heart to beat, your lungs to breathe, walking, talking, digestion of food. So everything that you do is actually controlled from the nervous system. And what is the nervous system? It's the brain, your brainstem, your spinal cord, and then all the nerves that go to the muscles, ligaments, and tissues and organs of the body. So if the brain and spinal cord actually control and coordinate the nervous system, if something gets pinched in the spine and the nervous system gets pinched, then it's going to actually irritate those nerves, and then you're going to have dysfunction. You're going to have any healing. It's not going to happen. Think about if God created your body to work at 100%. If you're healing at 100%, you're healthy. But what are you at 0%? You're probably dead, right? Yeah. So we're under stress every day. Your body, you're at work. You're under gravity. Just life is stressful, especially right now. So say, something happens and the nerves get pinched that go to your heart. But if they're working at 98%, your body's probably going to deal with that. Mm-hmm. It's not going to deal or have a problem. But if that's left over time, it's just going to get worse and get worse until it gets to 40% damage, which is about 60% function. And then you're going to start to have a symptom. So what happens when you have a symptom? You go to the doctor and they're going to give you pills. That's going to cover up that symptom. That's going to take closer to 0%, not to that 100. So our goal is to actually remove the interference from the nervous system, so we're leading you closer to that 100%. Think about Christopher Reeves. He was a healthy, happy man. He was Superman. He was riding a horse and he fell off that horse and broke his neck. He shoved the top part of his spine into actually his brainstem, and he lost all the communication from his brain down to his limbs. The rest of his body was working. He was still digesting food. His heart was beating. But over time, those started to shut down. So he had to have a pacemaker, and then his digestive system shut down. So his body just slowly shut down because the nervous system wasn't getting the function from the brain. Yeah. When he passed away, the doctors actually did research with him, and they said that he actually aged 30 years in the 6th that he was sick, because the system that actually controlled his health and healing just wasn't functioning anymore.
Yeah, it's good. So we always like to say, the inventor of chiropractic, nature needs no help, just no interference. Like, your body was meant to heal. However, when interference comes in, it causes dysfunction, or what we call dis-ease within the body. So Christopher Reeves, how can a little bump or fall off of a bike for my little kid create ADHD? Well, a little bump left uncorrected over the course of time creates interference, which therefore can create dis-ease and dysfunction. And what does our medical community look to do when we have a symptom? Put more interference in the body to actually prevent an interference problem. It really doesn't make any sense. So I want to talk about the nervous system, a little bit from a scientific, standpoint, is that really when you think of chiropractic, you think of balance. When you think of the 5 essentials, you think of balance. Like, life is about balance. Well, the brain is about balance. Like, you've heard of the term brain balance, or what are you trying to do? Well, you've basically got 2 different subsets of the nervous system. The central nervous system is composed of your sympathetic nervous system and then your parasympathetic nervous system. So if a tiger got loose in the room right now, Dr. Mary would go into a sympathetic fight or flight response, and she'd run away. And her blood pressure would go up, her digestive system would all the blood would pull to her extremities, which would slow her digestive system. Like, her love and affection for Scott, her husband, would go down because she's not thinking about that while she's running away from a tiger. Now, that is an awesome response if we're in a situation where we need to fight for our life. However, most of us, that response is left on when we're subluxated, when we've got chronic stress, when we're putting toxins into our bodies. We get in a car accident and it kind of whips us forward and puts our nervous system and our spine in that sympathetic fight or flight response, and it just creates disaster. Or we're kind of in that parasympathetic state, which is kind of like your rest and digest. Like, I'm foggy, I'm anxious, I've got some depression. And so we really don't want to be on either side. We want to be in the middle. And so this is kind of where I like to use the teeter-totter analogy. Chiropractic and the 5 essentials begin to bring some balance between these two systems. Like, your mindset. Like, how are you thinking about your health? Who are you listening to? It's really interesting. I had a conversation with a patient on Facebook just a couple minutes ago, and she was trying to talk to me about how individuals who were on medication for thyroid and heart disease and diabetes, like, that medication's making them healthy. And what I was educating her about was that it's not actually making them healthy, it's actually just treating their symptoms. The reason why they have diabetes and thyroid and cancer isn't because of a lack of medication, but because of imbalance between these two systems. And really, to be honest with you, one of the only professions in the world that look to balance this system is chiropractic and max living. And so Dr. Mary is going to talk about just in depth, like what does this look like from not just a, just a hard bone on a soft nerve, like I've got neck pain, but what does the nervous system really control?
So, people say, chiropractors are spine doctors, right? Well, yes, we are. But if the nervous system controls the whole body, why do we care about the spine? Because the spine actually protects that spinal cord. The actual nervous system is the only system in the body that's covered by bone. Your brain's covered by the skull, and the spinal cord's protected by the spine. So I like to talk about, think of a banana. If you have a yellow banana and it's nice and firm and you peel it, it's going to be yellow, it's going to be sweet. There's nothing to be wrong with it. But if that banana has spots and there's bruise, when you peel that banana, it's going to be mushy and there's going to be black spots on there. And it's not going to be sweet. So the same thing, something happens to your spine, it's going to affect your spinal cord.
Yeah, it's good.
So when the spine gets misaligned and gets subluxated, it pinches a nerve. So say that nerve's in your neck. Well, yes, of course you're going to have neck pain, you can have headaches. But those nerves also go to your thyroid. They go to your eyes, go to your ears. They also can affect your immune system. What about the hump? Maybe you have a hump in the back of the neck here,
The dreaded hump.
Yes, and we hate that, It looks bad and you actually can get pain from it.
Yeah.
But those nerves that are in that area go to your heart and your lungs. So if you have that hump, then your heart and lungs aren't going to work at 100%.
What I think is really interesting when you look at this picture, we've got a doctor for every single system that you see up here. We've got a cardiologist, we've got an endocrinologist, we've got a gastroenterologist, and the medical community looks at these as the body as individual parts working individual of one another. But the chiropractic, when you come into our clinic, we're looking at the body as a whole. Like if you're having liver problems, it's affecting every part of your body. The cool thing about the spine and nervous system is that it is the master control center of everything. So if you've got a gallbladder problem, you've got a spine problem. If you've got a liver problem, you've got a spine problem. If you've got an immune system problem, you have a spinal cord problem. And so, chiropractic is very simple. Chiropractic is about removing the interference so that way the body can begin to heal. With anybody, you see this beautiful little girl here, no signs or symptoms of anything. But the cool thing about chiropractic is that by adjusting the spine, removing interference and subluxation, the body begins to heal, whether or not we have symptoms or not. You think of it like almost like going to the dentist. My little boys had their first dental appointment last week, and they're so excited about the teeth. And I've got these little, they call them sugar bugs in your teeth, and we brush them and we floss them, and they carried around their toothbrush for 4 days. And that's kind of what chiropractic is. It's like we're looking for these sugar bugs or these subluxations on the spine that create problems if not fixed, right? So chiropractic is almost like brushing and flossing your teeth, but for your spine. The problem is that you really can't see your spine, right? And so a little girl like this who's got shifting of the spine, she may not feel it, she's beautiful, and she's happy and she's frolicking around, but yet that subluxation can still be there. And so chiropractic is for everybody.
And the scary thing is that it takes 40% damage before you actually have a symptom, which is 60% function. So, you have something going on and it just goes and goes and goes until you have that symptom. Like you said, you have dis-ease, we call it dis-ease in the body. But if you have a dis-ease in the body long enough, you're going to actually develop a disease. But just because you don't have pain doesn't mean you actually don't have a problem either. So pain-free people come in here all the time and their necks are almost worse than...
Well, it's actually my favorite patient to have somebody come in, or, mom's getting checked and then dad's like, I don't want to do this. He's got his arms crossed, I'm good. But then we take an x-ray and it's like, oh my goodness, I didn't know I had that, because my body has been adapting, because your body never wants to harm itself. It wants to adapt. And so, one of the ways that your body adapts from toxins is by, misshaping the spine. So thoughts, traumas, and toxins. If your diet's poor, if your mental health is poor, your spiritual health is poor, and your physical health, you're at a desk all day, what is a normal spinal position will begin to shift. And that's why when Dr. Mary and I take a look at an x-ray, I know that it's affecting your spinal cord based on what the function of the spine looks like. So, a normal spine is crucial for health, because as Dr. Mary said, what sits inside it. I tell patients all the time, I don't really care about your spine per se, I care about what's inside it. So our spine needs to be straight from the front, our pelvis needs to be nice and level. This is your sacrum. Your sacrum should be just underneath your skull. And so you guys have seen a scoliosis, right? So when the spine begins to shift, actually the Journal of Bone and Joint Surgery says that a scoliosis over about 18 to 20 degrees can take about 11 to 15 years off of someone's life, not because of pain, but because of the dysfunction in the nerves and the spinal cord, and therefore too much pressure can lead to disease and early death. From the side, the spine needs to have these 3 curves, and really specifically those curves need to be 45 degrees because that's the strongest structure, right, that can hold the load of gravity, right? So if I'm sitting at a desk all day, or I was a Division I wrestler, so I started taking front headlocks when I was 10 years old. All these types of traumas, McDonald's and fast food and stress and emotional stress, all these things can cause subluxation and cause the spine to shift. And when that spine shifts out of its normal position, it causes symptoms, or it may not, and it may just longer time in that position before you actually get a symptom. And one of the biggest reasons why it is that when you come in for an evaluation, we do an x-ray, is because an x-ray is how we detect abnormal position. Right? So when you look at an x-ray, I'm looking for, there's a couple different things with an x-ray we're looking at. I tell patients it doesn't tell me where to adjust, but it tells me how long the degeneration's been there. Right, so I can look at an x-ray and I can tell you how long your spine's been sitting that way based on the amount of disease or decay or the sugar bugs on your spine. And so we take x-rays from the side and we take x-rays from the front to make sure that you have these, what we call the arcs of life. This particular x-ray here is a curve of the neck, and so that curve needs to be 45 degrees in order for the brain to actually communicate to the rest of the body effectively. Any kind of shift, just a little bit out of place, can put pressure on those nerves and affect how that brain communicates to the rest of the body. And I also say too that, taking x-rays lets me know where to go. I hear it all the time, we hear it all the time. I've been to a chiropractor for 5 to 6 years. I've been to a functional medicine doctor for a long time, and I feel better, but I'm just not there yet. Well, have you ever had an x-ray of your spine? No, right? The one system in the body that controls all the other systems you haven't even seen yet. And so it's a vital piece in anything, whether it be digestive system problems or cancer. You have to make sure that your body is functioning and healing as close as possible. So, Dr. Mary, whenever you take an x-ray on somebody, what are you looking for there?
So when we actually look at an x-ray, it's the only reliable source that we do have to see where the position of the spine actually is. So when we take those x-rays, like Dr. Brandon said, we look at the front and the side. We draw up to 36 lines and angles on an x-ray to see exactly where the position is out of normal. So it tells us exactly where that's at, how long it's been, and what we need to do to get this corrected.
Yeah, I always, when I think of like 36 different angles, I tell them that in Max Living and what we do here, we're almost like engineers for the spine, right? So if I've got a bridge that's falling down and I go call a structural engineer, he's going to look at how to rebuild those angles. And the same thing with the spine. I think it's funny that so many people worry about their teeth, but how many sets of teeth can you get?
Well, as many as you want
if you've got the money for it. But the only spine you're ever going to get is the one that you have in your body right now. And we just a lot of times we don't care, not because we don't care, but because we don't know. And so having an x-ray lets us know exactly where to go, how long it's been there, and really helps us set the course for what does your care look like, and is your spine fixable and correctable, and how long will that take? So it's a very valuable tool.
Yeah, people come in and they're like, do I really need to have an x-ray? Do I need, and it's of course, because, if you went to your cardiologist, would you want them to start treating your heart without doing any kind of test or an EKG, or going to an orthodontist and then put braces on your teeth without even seeing them?
Oh yeah.
So it's crazy that you would never do that. So why would you want to work on someone's spine, which is the vital piece in your body, without actually seeing it first?
Yeah, like going to a cardiologist and having them do a heart cath without doing an EKG first to make sure that you need the heart cath. It's pretty interesting. People ask us all the time, how do I get subluxated? And my answer is really, it's kind of funny. I have no idea. Everybody's different, but we do call them the 3 T's, right? So thoughts, traumas, and toxins. So our thoughts. When someone's in a really stressful, like right now, it is a time when, just everybody's kind of in sympathetic fight or flight mode, very polarizing times, very, everything is just super, super offensive, and so we're all in this kind of fight or flight, like non-confrontational kind of mode. And so, being stressed like that spikes our cortisol levels, that kind of presses the gas pedal, and so that can cause this forward head posture. You're never like in this kind of relaxed position, during stressful times. You're always kind of like in this position, right? The other one is toxins. So the air that we breathe, the water that we drink, the food that we put into our body, our lack of sufficiency when it comes to vitamins and minerals and nutrients, and just like I said, not living the 5 essentials. And so all these things, what we're going to talk about later is that this process called accelerated glycolytic end products from sugar and bad fats will literally destroy the spine. And then we've got trauma. I think, people think of trauma as like I have to get hit by a car or I have to be in a car accident before I have trauma. It's actually the repetitive micro traumas over the course of time that I see are making spines worse. I mean, have you ever seen spines as bad as we've seen them in young kids?
It's awful.
No, I've never seen spines the way that I've seen spines in young kids today. I'm talking 12, 13, 14-year-old kids with no curve in their neck and already phases and signs of arthritis from being on a phone and wearing a heavy backpack with their head forward, playing sports, but yet not doing anything to maintain the health of their spine like they would their teeth. So here's what we're going to do. As we begin to kind of transition into, how the 5 essentials health, we're going to cover nutrition, we're going to cover, exercise. We want to give you, if you're out there and maybe you're not a patient or you're not a part of the Warrior Patient Program, it's okay. We want to bless you with an opportunity to be able to get your spine checked. I will tell you what we're going to talk about here over the next half hour. It's all good stuff. Like, you're going to be healthier because of that. But if you miss this piece and you're not having your spine adjusted or at least checked, you're missing a huge part of where health and healing comes from. So what's normally $170 for the first visit, and then even more than that for the second visit, to actually see if we can actually take your spine, put it in the position we need to, get an adjustment to take pressure off the nervous system. We're actually going to do the first 2 visits in our office for 60% off. So an unbelievable opportunity for you, your family, your friends, your kids, to come in, get their spines checked. You're going to meet with Dr. Mary. She does the first evaluation. She's going to do a case history. She's going to maybe take some x-rays depending upon if you need them or not. We're going to do some neurological, postural evaluation. She even kind of digs into your nutrition and your exercise and your lifestyle. We're going to do that first and second visit, which includes your first adjustment and potential stress x-rays, for 60% off. And so all you have to do, there's going to be a link in the comments. Click that link. And we're going to go ahead and get you scheduled for that new patient appointment. Dr. Mary and I can't wait to see you in the office.
Yeah.
So we're talking about balance. We talked about how in order to be healthy, health is about balance between the central nervous system, the sympathetic nervous system, and the parasympathetic nervous system. So, one thing is the 5 essentials. And the 5 essentials, your nutrition, your mindset, minimizing toxins, and exercise play a key role in your nervous system and your spine becoming balanced. So we're going to hit that in a little bit greater detail. I think nutrition is vital. It always used to drive me nuts when I would hear chiropractors or people say that, hey, you shouldn't talk about nutrition in your office because it's not chiropractic. And I would say to myself, well, this is the way that I live my life, and this is how I feed my kids, and this is what I do. Why wouldn't I want to teach that to my patients? And I will tell you, too, that it always makes me feel good. And I'll tell you, in the 10 years, and maybe the 25 years you've been in practice, Dr. Mary, individuals who eat better and live the 5 essentials and exercise, their spines always respond better, and they get out of pain, and they get better quicker. So some of the things that we're going to talk about today, nutrition-wise, have a lot to do with neurology, because really the nutrition that we teach, the fat, the supplementation that we recommend is all for a healthier, more vibrant nervous system. Because here's the reality. 2,000 years ago, everything was perfect, but now it's not, right? It's just we live in a crazy, crazy world where in every street corner you've got the opportunity to hit a Starbucks, and it's just, we've got to step up our game when it comes to nutrition. And when it comes to nutrition from a chiropractic standpoint, it's all about your joints. So, really where 2 or more joints come together, there's cartilage, there's synovial fluid, and really your nutrition plays a key role in those joints becoming healthy, especially the joints of the spine. So I've got patients that are coming in, we've seen this, that, hey, I eat McDonald's, I'm on the McDonald's diet, I'm on a ton of different medications, and I'm 40 years old. How did my spine decay that fast? Because 1, we're sitting all day, we're having all these traumas, but we're feeding our body all these toxins, which are just speeding up that degeneration process. So, the aging process as well as active lifestyles deteriorate cartilage. I've had 6 knee surgeries on my right knee. I've got a plate holding my neck together. Like, I don't really have a choice whether or not I can exercise and take care of my body, because I'm already kind of at a disadvantage. When it comes to nutrition for the spine, I like to think a couple things. One, increase our healthy fats, right? So we talk about, higher fat, low sugar. Well, the reason why higher fat is good is because higher fats and good fats have what we call omega-3 fatty acids. So really you want to have a 1 to 2 ratio of omega-3 to omega-6 fatty acids. But the problem is that when you're eating the standard American diet, you have a 20 to 1 omega-6 to omega-3 fatty acids. Now, the omega-6 fatty acids are the bad ones. They're the ones that cause inflammation. They're the ones that spike your blood sugar and cause oxidation of cholesterol, which is why your cholesterol goes up. Those are the ones that cause achy joints, right? Also limit the sugar. So a higher fat, lower sugar diet is a really, really good chiropractic nutritional program, because sugar increases what we call ages. So you can actually see here accelerated glycolytic end products, and what it does is it actually speeds up the process of osteoarthritis. So anything that ends with itis means inflammation, okay? And so these accelerated glycolytic end products are created because of bad fats and high amounts of sugar and stress. So just by increasing the good healthy fats in your diet, things like wild caught fish and grass-fed beef and omega-3 fat like nuts, avocados, things like that, and decreasing your conventional meats and your bad oils, things like canola oil and vegetable oil, which really aren't even vegetables. It's just like man-made stuff. They didn't squeeze a vegetable and oil came out. Like that's not how that works. But all those things create like kidney disease, liver fibrosis, stenosis, acute lung injuries. Like so, right now we're all worried about our lungs because of this flesh-eating virus. I mean, we got to think about what we're putting in our body that's accelerating that healing process. We've got to make sure that our bodies are void of inflammation, because these particular accelerated glycolytic end products can actually decrease and lower the joint spaces within the spine, eat away at the joints of the discs, the hips, the shoulders, and then it's like, hey, I'm 75 years old, my spine's a mess, and then I have to have a hip replacement, right? So we've got to make sure that we're doing these effectively. The microbiome. So a couple things with the microbiome is that, there's a lot of research out there, and it's actually, as it becomes more of a newer field of science, I was actually reading in Pain Journal, which is really interesting. This is actually the Journal of Pain in 2019. They actually looked at fibromyalgia patients, and patients with fibromyalgia, which is really, if you look at the word fibromyalgia, it's chronic nerve pain, unexplainable chronic nerve pain, which a nerve comes from the nervous system, chronic pain. That's what we do, right? So if you've got fibromyalgia, I can't tell you how many patients have come into our office and they're doing way better and they're off half their medication. So this study in Pain Journal 2019 looked at the altered microbiome in fibromyalgia patients, and what they said is that these researchers found 19 different species of abnormal bacteria in the guts of individuals with fibromyalgia. And then they said here is that this evidence now kind of opens up the door to how we think about pain, because up until now, if you go to a chronic pain clinic, you're getting injections with corticosteroid inhalers, things like that. So, needles in the spine and the shoulders and the hips. But this is the reason why it is that we pay attention to the gut. This is why we pay attention we do gut health workshops, we do probiotics. Like, we have you taking these supplements because a healthy gut is going to decrease that inflammatory response, decrease those accelerated glycolytic end products, and decrease that degenerative process. So the gut plays a huge role in chronic pain and irritation. One of the things that I like to talk about is that, we do have some things for you. Maybe you're that person who's like, I waited a little bit too late to come see Dr. Mary and Dr. Brandon, or I just want to kind of get ahead of this stuff. We've got what we call the Forever Young bundle. I love when patients come in and it's like, hey, my spine's falling apart. I went to my primary care. They did a bone mineral density scan on me. I've got osteoporosis, right? And then they want to put me on Fosamax, which is a horrible drug that creates all kinds of issues. And so we actually created a bundle for you that's got healthy things like OsteoForce, which is, high amounts of bone building, vitamins and minerals, and like basically a bundle that will help you. Things like collagen that will help rebuild and kind of replenish the joint spaces and things like that, along with exercise and chiropractic. Like, we found that this is a healthy way to be able to manage, or to kind of piece together some of the pieces that were broken off from the past 35 years of maybe not living a good, healthy lifestyle. So, this is something that we have available. And as a Warrior patient, we're going to give you an amazing opportunity to get 20% off at the end of the talk.
It's never too late.
It's never too late, right? So regardless if you've been this way for 25, 30 years, it's never too late to, I tell patients, it's like, it's better to be 1 in 20 than 0 in 20 and never start, right? So we can always, working on your health, it's always a good investment, because you're always going to be better because of that. I think it's really interesting that if you're not proactive with your health, like, what does the medical community do? If you're in chronic pain, I've been one of those individuals. I had the neck pain, I had the cortisone shots, I've had this stuff done before. But a lot of people don't think there's other options. I mean, if I were to really go back and think about it and do it all over again, I wouldn't have had the surgery if I know what I know now, right? I mean, we all say that. We've had multiple patients come into our office that got numbing in their fingers, numbing down their legs. They start getting adjusted, they start living the 5 essentials, and their lives are radically transformed. They canceled their surgeries. But this is actually the British Journal of General Practice talking about the dangers of Nsaids, which are over-the-counter painkillers. I mean, I've seen patients tell us that before they started coming to see us, they're taking, 800 milligrams of ibuprofen twice a day, right? And so this is what they found. They said bleeding is a better known consequences of all types of Nsaids. They say Nsaids increase the risk of GI bleeding 4-fold. It says COX-2 inhibitors increase that by 3-fold. Prescription of Nsaids with corticosteroids. So Nsaids combined with corticosteroid injections, a 12-fold increased risk of GI bleeding. So literally putting a hole in your stomach after eating all these things. So when we talk about minimizing toxins and how toxins affect your pain, like I said before, the body needs no help, just no interference. Why do you want to put more interference into a system that's already interfered with? We've got to think outside the box. There's better things that we can do here.
All right, so I'm going to talk to you ladies out there about all the cosmetics and the beauty.
Come on, I wear deodorant too.
That's true. So the cosmetics that you typically get at Walmart, at the stores, they contain a variety of very harmful chemicals and toxins. Some of those are phthalates, polyethylene glycols, and parabens. Those are some you'll see, you look at the back, those are ones that stand out. And what are those things? Phthalates, they actually are what they put in plastic to make plastic more durable. So it's crazy, we're putting those things on our bodies. The polyethylene glycol, that's antifreeze and brake fluid. Why on earth would you want to put that on your skin? When you're putting it in your car, you're trying not to touch it, but yet we're putting it on our skin when we, and then parabens are preservatives, and those are going to be hormone, they're going to inhibit hormones. So all of these things will, they'll disrupt your hormones. They have an increase in cancers. They're going to affect your detoxification of your liver. They're going to affect your skin. How many times have you gotten something, you gotten a product you put on your face and your face broke out, or you're using deodorant and all of a sudden now you've got rashes. It's crazy the things that we put on our systems and our bodies. So what we want you to do is look at the products, look for these chemicals that are in there and read the labels. If you can't read what the labels and you don't know what the terms are, it's probably not something you want to put on your body. We use lemongrass. That's a good they have a good makeup line. They have a good skincare line. There's Beauty Counter. That's another good one. Jason's, Alba, Schmidt's. Those are all really good products. And I know sometimes people are like, well, those are more expensive, those organic ones. But the Beauty Counter, it's a little more expensive, but I don't buy it every month either, because good organic clean products, you don't have to use as much.
Yeah.
It's just a little bit, it goes a long way, and it's actually so much better for you. Yeah. There's a website that you can actually go to, and it's ewg.org. And if you go on that, you can put your products in or search products, and it actually rates the products on how healthy they are, what's in them, and all the different things that are going to affect your body, and they're going to tell you what it does affect and how it affects it too. So
we'll put a link.
Crazy.
We'll put a link in the comments of the ewg.org, which you guys can go there and just, if you buy a product, you can plug it in there and you can see, is it safe or is it not. I actually read a study that a woman will walk around with 475 different chemicals on her skin every single day, just from the makeup and the hair products. So 475 toxic chemicals on a regular basis seeping into the skin. I've actually seen some research where when they do mastectomies on women with breast cancer, they're finding aluminum in the breast because of the toxic deodorant that actually doesn't allow the toxins to come out. So, even though sweating, we don't like to sweat, sweating is a natural process that needs to happen. And so that's really good stuff.
And, the household stuff, just like the chemical, the cosmetics that we use, there's, the bleach, the formaldehyde, they put formaldehyde in this stuff. That's what they embalm your bodies with.
Yeah.
Why would you want to breathe that stuff in? It's going to affect, asthma, reproduction difficulties. People have problems having babies because of these products, allergies, cancer. So they're all very toxic things in all the products. We suggest you use, vinegars, essential oils, baking soda. Those are good alternatives to get, clean, healthy cleaning products. 7th generation and Echos, that's a good one. That's a laundry detergent that I use. It's good. It's fragrance free, so you don't get any of those unhealthy chemicals.
I think you can get Echos from Costco, which is kind of like a coconut base. So they've got like a big jug. We use that.
Oh yeah, it's much cheaper. Yeah. And the website also has healthful products in it. So if you go on there and put your products in there, that'll give you the information on the different cleaners too.
I think too that right now we're spraying everything down with toxic disinfectants. So like I just said in the virus on week 2 was, even though we're spraying everything down, we're killing everything, we're actually wiping out the body's natural, microbiome. So, make sure that we're using good, clean stuff if we're going to disinfect. I'm not saying don't disinfect, don't wash your hands, but, what are you washing your hands with? What are you disinfecting? One of the first things I do when I go to a cabin or I go, somewhere where in the house they're spraying those Glade plug-in types of things, and I walk in there and I want to pass out, because when you're not used to all these toxins and whenever it's so strong, it gives you a headache. And so that's kind of a good way of knowing, am I in a toxic environment? When you walk into somewhere and you just massively get a headache because your body's sensitive if you're not used to that.
Just read the products, read it. If you can't pronounce it, don't use it.
That's right. Well, your body can't recognize it, right? If you can't, so I want to, with toxicity or just bad food or toxicity of the spine. I use this bucket analogy that over the course of our lives, we get all these different types of symptoms and just these things, these toxins that fill our bucket. And so eventually our bucket becomes so full that every time we move, more symptoms fall out, like allergies, sneezing, wheezing, pain, depression, anxiety. Our whole goal in this office and with myself and Dr. Mary and our doctors and our staff is to basically reach inside this bucket and pull the stuff out. I think the difference between our two medical systems is that one is trying to put more toxins in, and one is trying to bring more toxins out. One is actually creating more interference, the other one's trying to remove interference. Because you can't make somebody healthy by giving this person more drugs, because you may not be able to feel it, but the symptom and the toxin still stays there. So by removing these toxins, by cleaning up your makeup, by cleaning up your nutrition, by getting your spine adjusted, that's how you begin to empty the bucket so your body can respond. I want to talk about mindset a little bit, because I think mindset plays a key role. And it doesn't matter if it's nutrition, if it's your exercise, if it's your whatever. We are shaped by how we think, and it's unbelievable to me how many people just don't value their health, and so therefore they don't necessarily want to seek after like what true health is. Like I would rather go with what everybody else is doing, because I'm afraid to stand out. Like I said, I had this Facebook conversation with this person, and I'm like, don't you understand that somebody who's on diabetes medication isn't healthier? Their symptoms are better. Well, that's healthy, because we've been taught to think that medication is healthy. That when my back hurts, I go to a doctor to give me medication, and then I get surgery, and that's just how it is. So don't be afraid to think outside the box. As a man thinketh, so is he. And so make sure that you're surrounding yourself with individuals that are gonna not always tell you what you want to hear. I think it's important to be around people that are going to tell you what you need to hear, not what you want to hear, because I don't know about you, but sometimes I get around people that tell me what I want to hear, but I don't grow. And so I'm going to challenge you to do that. And one thing I'll challenge you with is, it drives me nuts. This is one of my biggest pet peeves ever. Is I've got people that come in all the time. They sit down with Dr. Mary. Oh, I'm getting old. My back hurts because I'm old. I've got diabetes because I'm old. I've got heart disease because heart disease runs in my family. My doctor said I'm just old. I mean, every single time someone comes in, my knees are falling apart, my hips are falling apart, my neck hurts. I went to my doctor. This happens as you get older. Well, a little bit of a mindset shift. Your spine, your health is not bad because of old age, right? It may be getting worse over the course of time because it's been that way for a while, but it's not because you're old, okay? you are responsible for your health. So a lot of times if someone comes in at 40 and their spine's falling apart, they've actually had problems since they've been 10. They just didn't know they had it. So perfect example I can give you is, the picture over here to your left, or sorry, your right, my left. This is my great grandmother. So she just turned 101 years old. This is my boy's great grandmother. So vibrant. If you notice, she's got somewhat of a pretty nice curve in her neck, right? She's got very minimal arthritis or degeneration in her spine. It's 101 years old, right? She's been on this planet, but she's done things a lot differently than what a lot of people would think of living. I mean, very simple life, very spiritual woman. Tries to walk, tries to get around. Up until the last 25, 30 years of her life, she ate a pretty clean, healthy diet. This person's in their mid-40s, and they've got more arthritis in their spine than my great-grandmother at 101. So your health and where you're at right now isn't because of your age. It's because of the lifestyle that you've chosen to live up to this point. And so when your spine is straight, structure equals function, the spine's going to break down. My great-grandmother has got this nice curve here. She's on no medications. I mean, she's healthy, she's vibrant.
Feisty.
So and feisty. She's tough. She's not afraid to tell people what they need to hear, and we need more of that in this world. So your health and where you're at has nothing to do with how old you are or just being old. Exercise. I want to touch on this briefly because I think exercise is something that, for instance, like I get a lot of people, Mom, if you're listening, I love you very much, but she says this all the time, I don't have time to exercise because I work so much, so my exercise is me working. But that's not what I mean, right? So just because you work 7 days a week or you're on the job for 8 hours a day and you're sweating doesn't necessarily mean you're exercising. What I mean by this is that we want to do exercises that are going to actually strengthen our spine and stabilize ourselves. So things like, how many times, grandparents out there, moms out there, do you pick your child off the floor, right? That's called a deadlift, right? So learning how to pick things up off the floor. I mean, how many times do you sit down on a regular basis, going to the bathroom, eating dinner, picking things up? That's a squat. If we're not doing these things on a regular basis, then we lose a lot of what we call our posterior chain, which is our butt and our hamstrings, and then our back and our hips have to take the load for what our butt and our hamstrings can't take anymore. And so then I get back pain and I got all kinds of issues. So not only do we have to do our spinal home care exercises, but we have to make sure that we're moving and we're moving well. Things like squats, things like deadlifts, to be able to strengthen our posterior chain so we can strengthen our spine. The next thing I want to talk about is sitting versus standing. I'm not going to spend a whole lot of time here. The big thing I want you to understand is that standing is way better. At the same time though, you can still stand in a sloppy position. Okay, so getting adjusted, making sure that you're standing in a good position, you're bracing your core, because you can still get lazy at your computer with a standing workstation. Also, just because you have a standing workstation is not an excuse for you to not get chiropractic, right? So just because your back hurts and your neck hurts, getting a standing workstation is not going to fix that. It may relieve it, but you need to make sure that you're getting your spine checked and aligned properly so that when you are standing under gravity, your body can do what it's supposed to do.
So a good thing to make sitting more fun, I know everyone's at work right now, or at home right now with work, is, we have our Wobble Cushions. So the Wobble Cushion is that inflatable cushion that we have everyone sit on. It's going to help strengthen and make stability, make the spine more stable. It's also going to help stretch and just get motion and movement in the spine, because motion and movement is very important. That's why we have our patients do their home care, their traction and their wobble. Just keep motion and movement in that spine, because 90% of the brain's nutrition actually comes from motion and movement. So it's crazy, you need to move. And that's why we actually have, you'll see in special ed classes where they actually have Wobble Cushions, because if they put these kids on the Wobble Cushion, it actually will help send signals from their prefrontal cortex, and it's going to calm down that sympathetic chain, kind of like what you said. It's going to cage that tiger back in and help calm them down, because they're going to get wobble and motion and movement and kind of feed your brain and get your brain, nutrients and what it needs to kind of keep going.
Yeah, it's almost like, if your foot's on the gas all the time, someone with ADHD or like autism, it just pumps the brake a little bit and kind of calms them down a little bit, brings them back into balance. The other thing too is if you're at work, don't be afraid to bring this with you and wobble intermittently throughout the day. This is like brushing and flossing your spine, you know, so brushing and flossing your teeth, your traction, your wobble are like brushing and flossing your spine. And then after you do that, that's where the weights are put on for you to strengthen.
I tell people, you know, Wes, we want you to do your weights with your wobble and traction twice a day, every day, but you can wobble and do traction anytime throughout the day. Absolutely. Whenever you're going to go to the yard, whenever you're going to do anything, you can do those. It's going to stretch and move them. You
can never move your spine or warm your spine up enough. It's good. So the last thing we're going to talk about is medicine is about disease and what makes people die, and chiropractic is about life and what makes people live. This is BJ Palmer. I think, you know, as we close out here, I want you to understand that medicine saved my life. You know, there's a time and a place for medicine, I think, for emergencies, but we're using our emergency medical system as a system to bring health to our body. And it's funny because it just never happens. You know, I think it was almost 20 years ago now, I was in ICU, I had fallen on my head, I had blood on the ventricles in my brain, and it wasn't for a pastor praying over me. They were going to drill a hole into my head to drain the blood from my head, and if it wasn't for emergency doctors, like, I don't know if I would be here. If it wasn't for great surgeons, I don't know if I would, you know, be here. And so I'm not saying that we shouldn't use those things, but at the same time, you know, chiropractic just looks at things differently. Like when someone comes in and they say, "Can you help me?" I say, "Absolutely." Because if we can take the pressure off the nervous system, we can remove that interference, amazing things happen. So Dr. Mary, end with your story about Corinne and just some of the cool things that you've seen with her.
Yeah, so my daughter, when she was born, she had a congenital problem with her liver. So she actually had surgery when she was 7 weeks old to actually connect her liver and her intestines because her liver didn't drain. And so, you know, that's a fix, but it was a temporary fix. We've known, you know, forever, 17 years, that she's going to have a transplant. But most kids that have this condition actually have had a transplant immediately because the surgery fails, or they actually have the surgery by the time they're 2. Wow. You know, and Corinne is 17. So we've, you know, kind of gone, she's had a couple ups and downs, a little sick here or there, but nothing major. Last year she did get really sick. She just got a bacterial infection and got really sick, was in the hospital. So that's when they determined, you know, let's go ahead and do an evaluation to see where she is, you know. We need to know. And every time the doctors came in doing the evaluation, they were like, you know, she's not sick. She's not been in the hospital a lot. What are you talking about? And no, you know, a little bug here or there, but nothing major. They just couldn't understand that why wasn't she sick like other kids. And she's actually in the 2% of where kids are her age that have, they're still native liver is what they call it. So, you know, it's crazy. You know, yes, medicine has saved her life. You know, she would have died without that. And, you know, she will have a transplant at some point. We actually, I haven't told you this yet, though last week they were talking about, we're going to do some follow-up visits with her. And, they were asking me about status 7 on the transplant list, and I didn't know what that was, and it's actually a hold pattern. So they actually want to put her in a hold pattern on the liver transplant list right now because she's so healthy. That we've actually had offers for the liver, and they've declined them because right now she really doesn't need that liver because we've kept her healthy. And I 150,000% believe that it's our environment and the lifestyle that we live that's kept her as healthy as she is, from having to have a liver transplant and getting to 17 without having to have this surgery.
The body needs no help, just no interference, right? So it's good stuff, good stuff. So hey, we're going to wrap up. Warrior patients out there, we love you. Thank you so much for being a buffalo and not a cow. And you know what I'm talking about when I say that. But hey, do me a favor, share this video, amazing information. Tag a friend in the comments, maybe somebody who has got some health issues that we really need to get an x-ray. We need to get them in here so we can begin to change their life. Tag them, and you're going to get 20% off our Forever Young bundle. Or you're going to get if you don't want the Forever Young bundle because you don't have osteoporosis or a lot of joint issues, you can actually substitute that with our Essentials bundle. So one of the two, they're both really, really good for the spine, and we're going to get you 20% off your choice. So like I said, share this video. I'd love to get 20 plus shares. Amazing time I've ever had an opportunity to do something with Dr. Mary, so it's always a blessing. Tag some friends in the comments. Next week, we're going to be having next level nutrition and detoxification. I may actually have my wife or Dr. Stephanie come on with me. I'm not sure. I haven't told them yet, so don't tell them. But it's going to be amazing. We're going to go high level. So make sure you're strapped in. It's going to be pretty awesome. And so, hey, I think on behalf of myself and Dr. Mary, we thank you guys so much for tuning in tonight. I pray you and your family have an awesome, blessed week. Bye-bye.